Good evening and thanks for joining us. After all the warnings about a second wave of COVID-19 this fall, some regions in Canada are not prepared for it. There are not enough tests, not enough labs, and not enough contact tracers. And the virus is spreading through some communities at an alarming rate. Quebec had a record high number of new COVID-19 cases today. The health minister there says it's too many to trace and they don't know where people are getting infected. In Toronto, there are reports more than 10% of tests in some neighbourhoods are coming back positive. That means uncontrolled community spread. Abigail Bimman has our top story tonight.
Federal health officials say if a community's positive test rate is higher than 5%, it's a problem. There's new data showing in some pockets of Toronto, the rate tops 10%.
That's where we have to focus on. We go out there, we put the mobile testing units up, we get more advertising within those communities.
That is very concerning. Those rates are high, and those are neighborhoods and areas that we already knew were at increased risk based on other data.
Increased risk with a high number of racialized and low-income residents.
It's very alarming because, of course, the report is around specific neighborhoods in Toronto, but we know that people don't just stay in their neighborhood. And it is an indication that more public health measures are needed.
While Toronto's top doctor has been calling for tougher measures, the Premier isn't budging on closing restaurants.
You can't put people out of work. Tens of thousands of people destroy their lives, just like bang, that quickly.
Meanwhile, Doug Ford says they're making progress on the testing backlog, reducing it by 40%. As of Tuesday, all centres moved to appointment only, but trying to book a test in Toronto is a challenge, with each hospital on a different booking system and many full.
We are adding to the lineup of rapid tests that we have procured.
Health Canada has now approved the first antigen test, the Abbott PanBio. The government is buying up to $20.5 million.
This type of technology is not as good as the PCR-based test, but it doesn't mean it doesn't have certain advantages.
Abbott's own website says the PanBio provides preliminary results and can't be used as the only basis for treatment. But its advantages include being faster and easier to use. It's the test Ford keeps calling a game changer. Ottawa says it's valuable in isolated areas, and its strategy around rapid testing means using them to supplement, not replace, traditional ones. Abigail Bimman, Global News, Ottawa.
The federal government says more than 8 million rapid tests will be distributed across Canada by the end of the year. Here's where we're at today. Quebec reported more than 1,300 new COVID-19 cases. That is the most in a single day. In Ontario, more than 540 people tested positive. We're still waiting for the updates from Alberta and British Columbia. Those numbers are from yesterday. Alberta's chief medical officer, though, is sounding the alarm today, warning tighter public health restrictions could be imposed because community transmission is getting out of control. In Edmonton, many people are apparently ignoring the rules and not self-isolating while they wait for test results. As Heather Yourex-West reports, active cases in Alberta are now the highest they've been in nearly 5 months.
At 50% capacity with no weddings or large events, it's been a summer of treading water for this Edmonton restaurant. But its owner says they've managed to adapt so far.
To be able to do that and then now have to consider going back to where we were and having to pivot again and find another way to keep going through takeout and delivery and those sort of things. It's scary.
For the first time this fall, Alberta's chief medical health officer is warning new restrictions may be coming in Edmonton. Since the beginning of September, Alberta has managed to keep its curve relatively flat, but a surge over the weekend is raising concern over what's to come.
We have seen an escalation of cases in Edmonton, an increase in the reproductive number to 1.3 last week, and a rise in active cases.
What's behind the spike is under investigation, but health officials say it's clear that not everyone is following guidelines.
One alarming trend we have seen in our review of current active cases is about 11% of cases are attending work or still going to social gatherings when symptomatic while awaiting test results.
Part of the problem, a backlog at Alberta labs, means it's taking up to 5 days at times to turn COVID-19 test results around. Cases are expected to increase in the coming days, but the real test will likely come after the Thanksgiving weekend.
If we have a high case number in the community, the risk of having spreader events at these social gatherings goes up dramatically.
Not good news for business owners hoping to avoid another shutdown as Alberta inches closer to its second wave. Heather Yourex-West, Global News, Calgary.